Hi all, welcome back to my channel. I hope you guys are doing good. Today I am going to discuss about pressure ulcer and its stages. Let's move on to the topic. What do you mean by pressure ulcer? A pressure ulcer, otherwise known as pressure sore or decubitus ulcer or bed sore, is a localized injury to the skin and other underlying tissue, usually over a bony prominence, as a result of prolonged unrelieved pressure. The main risk factors are immobility, lack of sensory perception, poor nutrition and hydration, and medical conditions affecting blood flow. Let's talk about the causes of pressure ulcer. The first one is pressure. As you all know, prolonged unrelieved pressure reduces blood flow to the skin, leads to pressure ulcer. Second one is friction. Repeated rubbing causes a break in the skin. Third one is shear, a combination of downward pressure and friction. For instance, if a patient is in a semifalus position on the bed, usually the head end will be elevated. So the skin at the back tends to stick to the bed sheet, whereas the down part tends to move down. So there is a combination of downward pressure and friction which leads to skin injury. The last one is moisture, especially from incontinence of stool or urine, which leads to pressure sore. Let's have a look at the pressure prone areas in different position. So first one is the semifalus position. Here the pressure prone areas are occiput, shoulder blades, elbows, sacrum, ischial tuberosity, heels and toes. If the patient is in the sitting position, the pressure prone areas are shoulder blades, spinal protrusion, elbows, sacrum, ischial tuberosity, and heels. If the patient is in a supine position, the pressure prone areas are occiput, shoulder blades, elbows, spine, sacrum, heels, and toes. If the patient is in a lateral position, the pressure prone areas are ear, shoulder, hip, knee, and ankle. If the patient is in a prone position, the pressure prone areas are forehead, eyes, ears, chin, anterior shoulders, chest or breast, lower costal margins, iliac crest, genitalia, knees, shins, dorsum of the feet, and toes. Before moving into the stages of bedsore, let's talk about the layers of the skin. So the topmost layer is epidermis, followed by dermis, subcutaneous tissue, muscles, and bones. In the picture you can see epidermis, dermis, subcutaneous tissue, followed by muscles and bones. Here we can see about stages of pressure ulcer. Based on the degree of injury to the layers of the skin, it's been classified into 6 types. Stage 1, Stage 2, Stage 3, Stage 4, Unstageable, and SDT, that is Suspected Deep Tissue Injury. I have added IAD, Incontinence Associated Dermatitis, in order to show the difference between IAD and pressure ulcer. Let's talk about stage 1 pressure ulcer. Here, the skin will be intact with non-blanchable redness of a localized area, usually over a bony prominence. The area may be painful, firm, soft, warmer, or cooler as compared to adjacent tissue. It is difficult to detect in individuals with dark skin tones. So in the picture you can see just a non-blanchable redness and the skin is intact. How to differentiate blanchable redness and non-blanchable redness. So blanchable redness is normal. When you press the area with the fingertip, it turns white, and when you release the pressure, it immediately turns back to red or normal color. But in case of non-blanchable redness, the discoloration of the skin that does not turn white when you apply pressure. That is known as stage 1 pressure ulcer. So in the picture, you can clearly see the stage 1 pressure ulcer. As I said, there will be non-blanchable redness and the skin will be intact. Let's talk about stage 2 pressure ulcer. Partial thickness loss of dermis presenting as a shallow open ulcer with a red pink wound bed without slough. It may also present as an intact, open or ruptured serum filled or serosanguinous filled blister. So in stage 2, you can see skin peeling and also the blister especially filled with serum or serosanguinous fluid irrespective of intact, open or ruptured will also be considered as stage 2 pressure ulcer. In the picture, you can clearly see stage 2. As I said, there will be skin peeling and also the blister which is intact, ruptured or open is also considered as stage 2 pressure ulcer. Let's move on to stage 3 pressure ulcer. Here, full thickness tissue loss and subcutaneous fat may be visible, but bone, tendon, or muscle are not exposed. Slough may be present, but does not obscure the depth of tissue loss. So, in stage 3 pressure ulcer, the subcutaneous fat may be visible, but it will not involve the tendon, muscles, or bones. In this picture, you can clearly see the stage 3 pressure ulcer. As I said, subcutaneous fat may be visible. Next one is stage 4 pressure ulcer. Here, full thickness tissue loss with exposed bone, tendon or muscle. Slough or eschar may be present on some parts of the wound bed. So in stage 4, the muscles, bone and tendon will be exposed and there may be slough or eschar in some parts of the wound bed. And this is an example of stage 4 pressure ulcer. Clearly you can see the exposure of muscles and bones. Next one is unstageable. Here, full thickness tissue loss in which the base is obscured by slough or eschar. Slough is just dead cells which form a thin layer in the wound bed which will be in yellow or white in color. Eschar is dead tissue which formed a layer which is tan, brown or black in color. In this picture, you can clearly see the unstageable bedsore. So here it is full of slough and the second picture is covered with eschar. Both of this leads to delay wound healing process. The last one is SDT, that is suspected deep tissue injury. When a deep pressure injury is suspected but cannot be confirmed, the area of the skin may look purple or dark red or there may be a blood-filled blister. So in suspected deep tissue injury, you can only see the discoloration of the skin. It might be purple or dark red in color and also blood-filled blister will be considered as SDT, suspected deep tissue injury. Here is a best example of suspected deep tissue injury. As I said, the skin may look purple or dark red in color, and also the blood-filled blisters will be considered as suspected deep tissue injury. Here we can see about IAD, that is incontinence associated dermatitis. Incontinence associated dermatitis is also referred as perennial dermatitis, is an inflammation of the skin associated with exposure to urine or stool. So if a patient has incontinence urine or stool, it may lead to IAD, that is incontinence associated dermatitis. This is not a bed sore, but it increases the chance of getting bed sore if left untreated. So the skin looks like this if it is incontinence associated dermatitis. Let's talk about the prevention of pressure ulcer. The first one is frequent positioning, adequate nutrition and fluid intake, good skin care, provide air mattress APAM, that is alternating pressure air mattress with all comfort devices such as pillows, ring cushion, gel pads, and find the underlying cause and treat. As I said, IAD, incontinence associated dermatitis, may lead to pressure ulcer if not treated. In short, pressure ulcers or ulcer caused by prolonged pressure. It may be categorized into 6 types: stage 1, stage 2, stage 3, stage 4, unstageable, and suspected deep tissue injury. In stage 1, the skin may be intact and non-blanchable redness will be there. In stage 2, you can note skin peeling, and the fluid-filled blister is also considered as stage 2. In stage 3, the subcutaneous tissues may be visible. In stage 4, the muscles, bone and tendons may be visible. In unstageable, the whole wound bed is covered with slough or a scar. And in suspected deep tissue injury, the skin discoloration might be in purple or maroon or dark red in color, and also the blood-filled blister will be considered as SDT. And we saw about IAD, incontinence associated dermatitis. If it is not treated, it may lead to pressure ulcer. Thank you so much for watching this video. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jevin Shine. Don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Jevin. Bye bye. Take care.